Well, hello, and welcome all to the State of Cybersecurity in Healthcare, our second annual virtual summit, looking at the various critical aspects of cybersecurity in the healthcare setting. I'm Carol Flagg, Managers Media Network, and this event is presented by the Association of Executives in Healthcare Information Security, or AHIS, Digital Health Insights, and Answers Media Network. This event would not be possible without the support from our three sponsors. Scenario's healthcare cybersecurity platform is tailored to safeguard medical environments against constantly evolving threats. From real-time detection of malicious network activity to strategic microsegmentation guidance, the company delivers a robust suite of proactive and reactive protections that elevate the security of healthcare facilities and ensure the safety of the patients they serve. Learn more at scenario.com. And Zscaler enables healthcare organizations to securely transform their networks and applications, enabling the delivery of new care models and improving patient outcomes. Trusted by leading healthcare organizations across the globe, Zscaler operates the world's largest cloud security platform, protecting healthcare from cyber attacks and data loss. To learn more, visit zscaler.com/healthcare. And Assembly. Assembly is an industry-leading risk management platform that secures IoT and IoMT devices for healthcare organizations of all sizes. Their mission is to provide proactive, efficient, and accessible cybersecurity solutions that empower businesses to safeguard their digital assets. The company's clients remediate threats to their network 10 times faster with fewer resources to the top 2% of real-world vulnerabilities. To learn more, visit assembly.com. And before we get started, if you're considering attending the VIVE conference in Los Angeles next month, Digital Health Insights has a $150 promotion code discount that you can use to apply to your registration. So check it out. And now here is today's agenda, comprised of an ongoing address followed by 5 sessions with the schedule listed here. You may use your attendee link to go in and out of the summit throughout the afternoon. Use the Zoom webinar dashboard to change your view and to raise your hand to communicate with me. There is no formal Q&A. However, contact info for our panelists will be provided post-event. And now I'd like to introduce our keynote speaker kicking off this event. Dr. Christian Dameff is an assistant professor of emergency medicine, biomedical informatics, and computer science at the University of California, San Diego. He also co-directs the newly launched UCSD Center for Healthcare Cybersecurity. Christian, welcome to the party. It's so good to have you on board as our keynote. And I'm going to turn this presentation over to you today.
Okay, wonderful. Thank you so much for having me. Can I just get a verbal check real quick on confirmation?
Yep.
You can hear me. Fantastic. Well, thank you for the introduction. Thank you for the honor to be here to present to you today. I'm going to talk about a couple different things, some things you know, and hopefully a little bit of a drive for us to move in a different direction collectively. I'm Christian Dameff. Many of you out there may know me in this space, but my heart is really in emergency medicine. So I'm trained as an emergency medicine doctor. Forgive the scrubs. I have a shift after this session. That's where I really, where my passion is in taking care of patients. But I also grew up as a hacker. And so my role is also split with operational cybersecurity as medical director of cybersecurity. I do a lot of applied cybersecurity healthcare research. We're going to talk a little bit about that in a few slides. And then our new Center for Healthcare Cybersecurity is an interesting new direction where we can apply a lot of our research, a lot of our operational work, and focus it towards solving some real world problems, not just at our organization, but actually all around the world. I kind of alluded to this a little bit earlier. The reason I know anything about cybersecurity is because when I grew up, I was just a hacker. We didn't call it InfoSec. I never thought it could become a job, but really where I spent most of my teenage years was not on the football field, but it was behind a terminal. And so in this case, you'll probably see me around at a lot of the hacker conferences and things, but applying these two worlds of medicine and cybersecurity is what drives us today. All right, so I want to start off and say it's always important to reflect on where you've come. And I think it's really important to talk about our shared collective past. So all of us are here on this webinar for a reason. We're interested in healthcare cybersecurity. And some people may have been around from the beginning and some may be new to this party. But it's important for us to talk about where we've come from. It used to be the case that we would have security researchers who would purchase medical devices from eBay or other places, and they would find pretty concerning vulnerabilities, and they would show those to the world, and it would cause a lot of change. A lot of people would go and secure their devices better. It would cause a lot of concern for people. A lot of patients were concerned. But our collective past was born out of this kind of hacker finding vulnerabilities and showing them to the world. We have very much come from a place where cybersecurity was seen as an afterthought. In many places, it still is. Many of you out there still have to fight tooth and nail for cybersecurity funding at any level. But it used to be the case that healthcare did not care at all about cybersecurity, and that the only constraints on them in that regard was their concern for protecting patient health information, really the pre-ransomware era. We had an issue where we did, for the longest time, a lot of people didn't believe healthcare cybersecurity was a threat to patient safety or to care. And I remember many people arguing very vehemently in one direction or the other about how this discussion might be overblown or not. It's no longer the case anymore. Lots of times now, top executives understand that this could potentially even be an existential threat to their organization and a threat to the lives and safety of their patients. And we also had, for the longest time, very little regulation in the space. I mean, HIPAA has buoyed healthcare cybersecurity for many, many years now, but we've seen some movement with regulation, especially in the last 8-9 years with government organizations like the FDA, who, with the pre-market guidance final coming out last year, and a lot of the actual teeth behind that, we've seen a lot of shift from what was traditionally a rather unregulated cybersecurity landscape in healthcare to one that is becoming increasingly regulated. Now we could talk about the benefits and disadvantages of such a thing, but this is where we've come from. Rogue cybersecurity researchers trying to do the right thing for the most part, some bad actors in that space. Now we're working with security researchers. Leadership not caring at all about this issue. Now it's the discussion of the board when every time they meet. Cybersecurity is now a patient safety issue. Many organizations recognize that. And we're seeing a tide of regulation shift. This was really, to me, something I never thought I'd see, actually, was the final guidelines being released. And again, the statutory authority to enforce such a thing. That's just in medical devices with the FDA. I think we're going to be seeing at least some attempts at regulating hospitals coming up here in the next year or so regarding minimum cybersecurity requirements for participation in something like CMS. But a lot of people can say, wow, look at where we've come from. We're all done. We can just ride into the sunset. Look at what we've accomplished. We're already moving in the right direction. A lot of places we're already there. We're done. Well, I think we all understand that's not indeed the case. Some of you out there might recognize this man. This is Stefan Savage. He's a very well-known cybersecurity researcher and did the first work on hacking airplanes and cars. And I would keep talking about this problem to him, about solving these problems. We need to solve these problems of medical device cybersecurity. We need to solve this problem of healthcare ransomware. And he just said, stop, stop, stop. We are never going to solve cybersecurity. There's always going to be a new attack, a new vulnerability, a new malicious actor in this space. And he said, just stop talking about it like you're going to solve it. And that really struck me because then I was left with, well, we're forever going to be in this cybersecurity hamster wheel, right? Where, well, it's great for job security. It probably isn't very good from all of our sleep. But if we're never going to solve this issue, we're never going to solve these problems that plague us, then kind of, is that a bummer? Is that a downer? I reflected upon that for a long time, and I've come to the realization that we have to continue to evolve, continue to change, despite where we've come from and all the advances that we've made. And I have only time today to talk about a few of them. But here's what I think we need to start coalescing around and really start focusing in, and it's moving together. First, again, we're going to have to work together. all of you on this call know that threats are not decreasing, threats are increasing. This is Hannah Napresh's work that showed healthcare ransomware attacks essentially increasing over 5 years, including the amount of protected health information that's being exposed. We know that the trends have only continued in an upward fashion for the last 2 years. So if the threats are increasing, particularly around ransomware, um, what are we going to do about that, knowing that we are not all independent? We are all in this symbiotic healthcare relationship. What do I mean by that? There's an ecosystem of care. The number of organizations that are in a particular geographic location, our payer mixes, our population that we care for, the interconnection between centers that are trauma centers and STEMI centers and stroke centers, all of this really points to this, undeniable fact that we are connected in many ways, far more than we even recognize today. One example of that was the paper we published last year that looked at what happened to adjacent hospitals. A ransomware attack has happened to one hospital. What's happening to the hospitals around them that are not infected with ransomware, but share the same geographic location? And we found some pretty disturbing things. This study was looking at 4 weeks before an attack, 4 weeks during the attack, and 4 weeks after the attack. We measured two hospitals around a four hospital system that got impacted. And we measured primarily things that we were worried about in the emergency department, like how many patients were coming, how many ambulances were coming, how long were people waiting to get emergency care. And then we also zeroed in on one population that we found was particularly concerning, which was that of stroke. Stroke is an emergency. It's a neurologic condition where blood flow to portions of the brain has been compromised, interrupted. Every time there's a stroke, the clock is ticking, and you only have a limited amount of time to help that patient before your treatments really aren't effective. We focused in on that population because we wanted to see what happened in this community, where 3 out of the 4 hospitals that were ransomed were stroke centers. So we wanted to see what happened. And I'm not going to go through this lengthy table. If you want to go read the paper, it's open access, so you don't have to pay anything for it. Just go to the JAMA Open website. But we saw more patients than we traditionally would see. We saw sometimes 3 times the amount of ambulances that we normally would see in a day. We just had so many more ambulances waiting. I remember working a shift and seeing them lined up against the wall. We had so many ambulances in our ambulance bay that they had to park on the street. We had more patients that left without being cared for. They waited so long in the emergency department that they left without being seen. We had a lot of patients waiting really long times in the waiting room, as well as if you were super sick and you were at our facility, then you actually waited longer to get into a hospital bed once you were admitted. So you stayed in the emergency department for a long time. Long story short, emergency care hugely impacted. We weren't even hit with ransomware, but we were still severely impacted. This is a graph that shows that the ambulances in the city and county of San Diego, what was happening to them. When the hospitals were ransomed, they went on a status called diversion. So they weren't accepting emergency traffic. They weren't accepting ambulances. This graph shows the cumulative number of diversion hours in all the hospitals in San Diego County. You can see the 4 weeks before the attack on the left, between 20 and 40 hours of diversion a day. And then during the attack, do you see that gigantic spike there? What does that mean? It means that hospitals that were with ransomware, they couldn't see patients. Those patients did not stop getting sick. They just had to go somewhere else. And it was hugely disruptive. Transport times anecdotally increased. So it took you longer to travel to a hospital by ambulance. You waited longer to get to that hospital, but also while you were there, you boarded on the wall before the hospital could accept you. This was hugely, hugely impactful. And then I mentioned this, our stroke patients. We saw far more strokes. We saw 59 the month before, and we saw 103 strokes during the attack, and then 65 after. Huge, huge resource problems with this. We only have a limited number of CT scanners and MRIs and neurologists and things like this. And when all the strokes have to be shunted to one facility or two facilities in a region, it can really, really impact care. Well, on that kind of sobering note, we can recognize threats are increasing. We recognize that we're all connected and that we're all in the kind of same cyber boat, wherein it's not just protecting my own network and I'll be just fine. Now we all have to worry about each other's networks in a region, because if one of us would be unfortunate enough to be hit with ransomware, for example, it will impact the hospitals around them. So recognizing that we all have to work together. Two, we really have to grow. We in medicine today, we make a lot of mistakes, but we make far less mistakes than we used to. And what do I mean by that? How do you know what treatment to take? You take treatment A, treatment B. You go to your physician, and hopefully there's some reason why this particular medicine over this other medicine or treatment should work and should be recommended or should be more efficacious. Well, if you were to go see your doctor, 200 years ago, 300 years ago, they might look something like this. Not really as many of them didn't look like this, plague doctors, but the former state-of-the-art treatments for medicine hundreds of years ago were things like leeches, mercury, and bloodletting. And that was considered the standard, right? That's the state-of-the-art treatment for almost any condition was going to be leeches, mercury, bloodletting. Now we look at that now as horrendous, and we know that in many cases, mercury is toxic, as well as bloodletting, except for very rare medical conditions nowadays, just doesn't do anything except make you more likely to die. And so we laugh at these treatments now, but they were the state of the art then. How did we go from leeches, mercury, and bloodletting to what we have now, which is some of the most sophisticated technology and treatments the world's ever seen? These were some of the surgical instruments. In the past, they didn't sterilize those, but now we are meticulous and wash our hands. Something as controversial as washing your hands 200 years ago is standard practice now, and any doctor who wouldn't do this is committing malpractice. Well, we employed the scientific method. That's what we did. We critically appraised our treatments, and we figured out that this one wasn't working, leeches wasn't working. We moved on, and we were able to test these things and apply the scientific method to come to an evidence-based conclusion about whether or not a drug A or drug B works. This is the evidence pyramid. I just want you to look quickly. What's on the very top? Things like meta-analysis and systematic reviews. In the middle are trials where you randomly control the different variables using control groups. But at the bottom, in green, is what I want you to pay attention to. The lowest level of evidence is expert opinion. Wow, you would think that expert opinion would be a little bit higher up on the evidence pyramid, but at the very bottom of it is expert opinion. So perhaps a controversial statement, but I think this might be true. Are we in the bloodletting days of healthcare cybersecurity? Are we sprinkling mercury on our firewalls and thinking that it's actually doing something? This is what I would propose to you is a direction we should start moving towards, which is evidence-based healthcare cybersecurity. Expert opinion. In many cases, it's things like frameworks. Many instances, regulators rely on expert opinion. There are a lot of vendors in the space that offer you their opinion about whether or not they should do something and offer you a report that says this product is better than this product, but without any really sound scientific basis. Social media has a lot of people telling you what you should do for healthcare cyber, and they just happen to have big followings on social media, charlatans. Even people like me, you should always be critically appraising who's giving you information. And me being in front of you today, talking to you is no different. That is just expert opinion. And on the hierarchy of evidence, on that pyramid, it is the lowest level of evidence. We have a long way to go. So I would propose to you, how do you know what the right thing to do is if you don't measure its effect? How do you convince people to keep caring about this problem if you can't show them statistically with evidence who or what you actually saved? It's just an issue of who is a better salesperson who can be more charismatic and convincing in front of the C-suite executives. Again, let's move up this evidence pyramid to something that's far more defensible, which will require us to actually measure what we do, to share our results, and come together to say, hey, this particular control doesn't work. We got to go in a different direction. All right, 3, we have to plan. And my last little bit here, if we're going to come together, we're going to start measuring our effects, growing in that regard of applying the scientific method. Well, we also have to be strategic in our plan. I have to give a shout out to the Health Sector Coordinating Council. Many of you out there are aware of their work. Next month, they're going to be announcing, or they're going to be releasing their 5-year strategic plan as part of many of these efforts. And I'm excited to see what comes of it, primarily because its design really is to guide C-suite executives, security leaders, other technologists towards investment in particular cybersecurity principles, with the idea, again, of being able to measure them, to focus on patient safety, data privacy, and actually operational cybersecurity. So I'm excited to see what comes of this 5-year strategic plan and hope that we can get behind this strategic vision so we can not just secure ourselves, secure our neighbors, secure our nation's infrastructure and healthcare to be able to provide more resilient and secure healthcare. Maybe then, once we've done that, we'll be able to ride safely into the sunset. But until then, we still have a lot of work to do. And I always wanted to remind people that I talk to that many people have, many of you out there have very hard jobs. I just wanted to remind you that what you do matters. What you do in healthcare cybersecurity is important. And even though you may not be at the patient's bedside, putting in an IV or administering some medicine, what you do enables clinicians to do that. And in many ways, you have a hand in caring for these very sick and vulnerable people. That should be something you should be proud of. Thank you very much. And I don't think I'm actually taking any questions, but my contact information will be shared if you want to discuss further.